Now, guys, we've talked before about how much an average couple retiring can expect to spend in healthcare over the course of their retirement, about $315,000 or more. Half the people responding to a Gallup poll, that's for what's factored in, that your regular expenses, by the way. Half the people responding to a Gallup poll said one major health event is all it would take to force them into bankruptcy. So healthcare, as we said many times, a major factor when it comes to your retirement. What do you recommend for clients that are concerned about paying for healthcare in retirement?
Well, it's pretty scary when you stop
It
and
is.
look at the fact on that Gallup poll that says one major health event is all it would take to force somebody into bankruptcy. I think we were talking during the break, you had talked about some of the out-of-pocket maximum deductibles that are out there today are astronomical. I can think of a situation where I had run into a couple, and this couple was looking to retire early, and they were going to just, wait until 65 to get their Medicare supplement because they looked at the cost of health insurance, and it was so astronomically expensive that they just decided they're healthy. It's only a couple of years away. All of a sudden, she happened to fall. She broke her leg. Went to the doctors because of that. The leg ultimately got an infection, had to have surgery from that. And all of a sudden, she's got this major bill from the hospital, and I think it approached almost $100,000 is what it got up to.
Sure.
So some of those things that happen, is the reason why it forces people into bankruptcy. What are the things, Scott, that you kind of recommend to clients who are concerned about paying for healthcare in retirement time?
Well, Nolan, like you mentioned, if you go without, it could be absolutely catastrophic for you. I've seen a lot of claims this year. I use real-life examples when I go through my presentations, and, my mother's been in and out of the hospital 4 times. I can tell you these are real numbers I'm about to tell you. So she was in the hospital for 2 days. 2 days in the hospital. Emergency room, and then she went from the emergency room and she was admitted for 2 days, and they poked and prodded, they did IVs, they did some scans and things like that. $16,000 later. This is 2 days in the hospital, okay? Well, if you retire prior to 65 being eligible for Medicare, the marketplace premiums and plans, like I mentioned earlier, the deductibles went from 87 to 91 an individual. That's $18,200 for a couple or a family, right? You go in the hospital, you have to pay that deductible first. 2 days, $16,000. You're paying almost all of that out of your pocket. Do you have that kind of money just laying around to fork out $18,000? So she was in the hospital for 3 weeks. It was $78,000 for a 3-week stay in the hospital. So one of the things that is crazy, that 1 in 2 Americans are fearful that they're going to have a major health event that's going to bankrupt them. That's a crazy number to be that fearful that if you have a plan in place that's not going to properly cover you. So moving into retirement, if you're before 65 years old, you've got premiums that you have to be prepared for. And like we mentioned earlier, have some money set aside, have some buckets of money set aside for that out-of-pocket expense.
Well, I'm obviously biased because I'm the host here on the show with you, but this is an area where I think the financial advice overlaps the healthcare advice.
Absolutely.
Because they impact each other. I can think of a situation where we have met so many folks that were going to retire before the age 65, and that was one of their biggest questions is, how much is healthcare going to cost, and how am I going to pay for healthcare in retirement? Well, under the Affordable Care Act, the great news is everybody could get coverage.
Right.
It's not like it used to be in the good old days where, you could not get coverage and you had to continue to work if you had some type of healthcare issue. And in fact, a lot of the times people end up in retirement or forced into retirement earlier because of a health-related issue.
Right.
The reality is it's a matter of navigating the system. There's a system for those that are informed, and there's a system for those that are uninformed, and you want to be in the informed system. So retiring early, paying for health care in retirement, they're going to look at under the Affordable Care Act what your income sources are.
Right.
So if you're taking money out of your IRA or your 401k, that's all going to be countable income. that could dramatically increase your cost. So the year before you retire, you could look at things like a Roth conversion strategy. You could look at pulling money out of non-retirement accounts. You could look at using other sources to keep your healthcare costs down. Another thing, Scott, that people run into a shock to the system is I'll find people that say they want to be debt-free in retirement time. As a financial advisor, I can't think of probably much better advice than being debt-free in retirement time. And so if we looked at it just from a financial perspective, you might have a 67-year-old that wants to retire. They then end up retiring. They pull out a big lump sum of money and use it to pay off their mortgage. But what they didn't realize is that the withdrawal that they take out of their retirement account can impact what their Medicare premium costs are.
Absolutely. There are thresholds for income with Medicare. A lot of people don't really understand that until they get that sticker shock. Okay, the standard is 91,000 individual or 182,000 for a family tax filings, right? If that's where your income falls between there or below that, then your Medicare Part B premiums are $164.90. That is each person, okay? But it drastically goes up from there. The second is obviously if you're 182,000 up to 200, and I'm not real sure exactly the number, but it's like 250,000. You could be looking at over $200 a month for your Medicare Part B premium. A lot of people don't take that into account. Okay, so they're saying, well, Medicare is $164.90, no big deal, $165. That'll come right straight out of my Social Security check. I won't even see it's gone. You take a big lump sum, your income is reportable at a much higher rate. You're going to pay a lot more for that. The other thing, like you mentioned, is the Roth is not reportable income. That also, if you retire prior to 65, you're still going to need some health insurance. And one of the things that Nolan, you and I have done actually quite well working together over the past many years is getting their reportable income at a level that they can subsidize their premium and make it somewhat affordable on a month-to-month basis. If you don't properly prepare for that moving into the Medicare part of your life, they look back 2 years. Okay, so in 2022, they were looking back at what was your income in 2020. If it's over, there's premiums all the way up to $535 for Part B premiums. And if you're not prepared for that, I've got one client that's paying like $1,100 for him and his wife for Medicare. So you got to properly be prepared for that. So paying for health care in retirement, you got to make sure that you're prepared for that, and it's got to make sense.
And it makes sense to, as we say many times, if you've got time on your side, go ahead and start that retirement planning process ahead of time so you can do that. If you do plan on retiring 3 years from now, 2 years from now, there are things that you should go ahead and do now because that 2-year look back is going to be upon you. And if you can minimize that, the coverage doesn't change, right? Even if you are paying more in premiums, you're not getting the platinum plan or anything like that.
No, it doesn't change at all.
Okay, so again, it's all the more reason to have that strategy put in place, and there's no better time like the present. As we said many times here on the show, be prepared. 419-794-3030 is how you go about doing that, how you start that preparation. 419-794-3030, or go to the website, Americasretirementheadquarters.com. Want to thank you so much for joining us, spending part of your day with us here on America's Retirement Headquarters, as we always do. Really do appreciate it. Please take care of one another out there. Be safe. Guys, thank you. And as we wrap up, I want to leave you with the final word.
A good quote for this week, it's retirement is wonderful. It's doing nothing without worrying about getting caught at it. So have a great weekend. Have a great week, everybody. We look forward to seeing you here on Toledo's largest talk station, 1370 WSPD. Just remember, when you think retirement, think America's Retirement Headquarters, home of the retirement guys and America's Medicare Associates.